So I titled it Women in Dentistry because even when I was just going into the field, I thought, wait a minute, this is a woman's profession primarily, and yet when you say the word dentistry, you say the word dentist, people automatically think, no, it's, oh, a man. Okay? I mean, people still look at me and go, well, who's the dentist? I go, I am. Oh, really? So, of course, this lecture is dedicated to Hal Huggins, because I would not be standing here if it was not for him. I would not be alive today. And actually, I started having a conversation with Hal about 10 years ago and telling him that, gee, it's really odd that some of my closest friends in dentistry all have children with neurological, psychological problems. And 10 years ago, he said to me, yeah, you know what, you should do a survey and find out exactly how many people have that problem. And so I talked to him the day before yesterday, and he was thrilled that I finally did it and is giving the lecture, okay? So it really was his idea, all right? Problems in dental, these are our families. You got to keep that in mind. I'm not just giving a lecture on statistics and numbers. You know, I'm talking about us, our immediate family. Amalia Azor, she was, still need this? Amalia Azor is known as the first woman dentist officially in Sweden. Okay? 1852, she was actually given permission to practice. Dentistry was still considered a man's profession. But she came from a family of dentists. Her father and her brother were both dentists. She became a dental assistant. That's the way I entered into the profession, because it was deemed for men only. My father didn't even want me to go to college. He said, what are you going to do that for? You're going to get married and have kids. You know? Yeah, oh, I really want to go to college, Dad. She was unmarried, though, and had no children. The first American woman dentist, everybody knows, is Lucy Hobbs Taylor. If you say first American dentist, oh yeah, Lucy Hobbs. 1866, Lucy Hobbs Taylor was the first woman to graduate from an American dental college. She was married. Ah, no children again. Isn't that interesting? And she died of a stroke. Do I still need this? Okay. You'll tell me when. But this woman is my hero, Emmeline Robert Jones. 1864, as far as I'm concerned, she really is the first woman dentist. She started on her own. She said, oh, I need a license for this? Really? Okay. So, and the reason she practiced also was because she started as an assistant, watched her husband do everything, and then when he died, she took over the practice and said, I need a license for this? Okay. All right. I have a dental assistant who can do everything I do. No kidding. She's been watching me for a long time. Right, Becky? You can do everything I can do? Yeah, pretty much. Which I'm really happy. I can't wait till Tuesday to see how you're going to be my left hand. She was married and had 2 children. But then the floodgates were open. Lucy Hobbs Taylor, 1866. By the year 1900, wow, that's only 34 years later, 1,000 women dentists. Okay, University of Michigan has some statistics. They said, okay, in 1866, there was 1 woman dentist. That's 1.2% of the population of dentists. From 67 to 69, we still only had 1. But the number of dentists increased, so our percentage went down to 31%. 1870 to 72, now we've doubled. We've got 2 women dentists. But we're still only 0.51%. 73, we've doubled again. We've got 4 women dentists. Still only 1.08%. 76 to 78, 5 women dentists. Now we're almost 1%. And we continue to grow in numbers. 79 to 81, gosh darn, we're up to 1.12%. Then we go to 21 women dentists in 82. Actually, that was 100 years before I graduated. 85 to 87, we've got 23 women dentists. That's still only 1.59% of the population. 88 to 90, whoa, now we're starting to see an increase. 44 women dentists, 1.83% of the population. 91, we got 69. Whoa, we're getting up there. By the year 1900, 1,000 women dentists. It just took off. 1,000 women dentists. That's incredible. Today, women currently make up half of all dental students. So you can see there's going to be another exponential increase of women as the dentists. And they say 25% of practicing dentists. We're actually 26 now. According to the American Dental Association, they always tell the truth. Right? In November of 2012, there were 50,000, almost 51, female dentists in the United States, compared to the 142,000 male dentists. Dental hygienists. Again, most of the numbers come from 2012. We had a hard time getting a lot of specific statistics for 2014. So dental hygienists in 2012, 99% of the hygienists are women. We all know that. In May of 2013, there was an estimated 309,000 dental assistants. Dental receptionists. Nobody ever talks about the receptionists. Okay. Nobody ever talks about the receptionists. They're in the office too, and some of them are not so far from where the action is taking place. In a lot of offices, the assistant is the receptionist. They do everything. Okay, in 2012, 1,006,700 dental receptionists, which means by 2014, we're probably closer to 1.5 million women in the office. So do the math. 193,000 male dentists, 50,000 female dentists, 192 hygienists, 309 dental assistants, and 1 million receptionists. Guess what? Women make up the majority of the dental profession. Did you guys know that? What? Yeah, this is just the United States. So it is a woman's profession. I always said it should be a woman's profession. Now I know it is a woman's profession. It's not a should be. So we've got 1 million. Now I have nothing. Or can you hear me? Can you hear me in the back? Okay, so now we've got 1,753,466 people in the dental profession. Only 193,000 are male dentists. Sorry, guys. You are only 11% of the profession. So we better be concerned with women's health, how we're making babies, how our babies are turning out, how our hormones are changing differently than they did before we went into the profession. The Bureau of Labor Statistics, they got numbers too. They said 144,000 dental jobs in 2012, because they keep their numbers too. And they project 16% increase in that 10-year period from 2012 to 2022. That's a 10-year period. They're saying 16% increase. They're dead wrong. Okay? Because that would mean by 2022, we'd have 170,000 male dentists. Really? I don't think so, because today is now 2014, almost 2015. We already have 165,000. There's no way we're only going to increase by 5,000. Not with them talking about opening more dental schools now, because there's so much demand. Can you imagine, just imagine for 1 second, if everybody said, oh man, we got to get our amalgams out. we would be working 24/7. The lines would go down several blocks from our office, right? What? We're already working 24/7. And so that is definitely faster than all other occupations, and yet there's still a tremendous shortage. Women currently make up half of the dental students, 25% of the practicing dentists. It's actually 26% now. Before the 1970s, only 3.4% of the dentists were women. Okay, that's why I went into dental school in the 70s. Okay, but look at this. Oops, what happened? Yeah. Okay. So this is what I wanted to show you. This is the percentage of women dentists, and then it looks like it's starting to skyrocket here at 2010. 2012, it's really over here. By 2014, we got half of the women in dental school, right? And most of the women dentists still have female receptionists mostly, and everybody else in the office. So within the last 50 years, the amount of women in dentistry has steadily been increasing. Dental hygiene programs were introduced in the 1920s, resulting in the only decline in women entering dental school. Well, you know, that means that during that period of time, it was still frowned upon a woman going to become a dentist. So you know what? Why don't you just become kind of like a nurse? Okay? And so then all the women were convinced to become kind of like a nurse. And you know, that's what I was told to do. I was like, well, why don't you go to, you know, Columbia and go to hygiene? Why would you want to be a dentist? And then I had one dentist friend who looked at the program at Columbia and he said, 3 years to be a hygienist? Well, why don't you just do 1 more year and be a dentist? Duh. So in the 1960s, though, the percentage was a mere 2.3%. And then the women's feminist movement came, and they said, lady, you can do anything you want to do. And that changed everything. Okay? That changed everything. And the percentage rose from 3.4% all the way to today, we're above 26%. Okay, but here's the problem. Dentists are exposed to numerous toxins, not just the dentists, but the dental assistants. While traditional dentists are placing and removing amalgams with no protection, many in the profession are mercury toxic and don't even realize it. So, according to a recent study, dentists are 1.67% more likely to commit suicide than any other. This is all populations, all professions, non-dental professions. We're almost 2% more likely to commit suicide. And suicide in dentistry ranks second in all the professions, only behind physicians. Okay? With research conflicting as to why the reason is so high, because they don't want to look at the mercury issue. That's why they say it's conflicting evidence. Really? They say it's the tension in the office. Come on, there's tension in every office. Okay? Yes, we do work through breaks. What's a break? I didn't know what a break was until I went to California to work with David VRL. And the girls in the office there said, we're going to lunch. What? What's that? They said, that's where we leave the office and we have lunch. What? Yeah, wow. You know, not taking vacations, you know what, if it wasn't for seminars, we probably wouldn't take too many vacations because we consider this a vacation. All right? And of course, increase in mental illness, but you know, that's all part of the picture. You know, others say that the high level of toxins, yeah, let's talk about that because I think that's a big part of it. All right? In the general population, though, men commit suicide at a rate 4 times that of female counterparts. And yet other research says that it's 50-50. Okay? Mental illness is usually why somebody commits suicide. Hardly ever properly diagnosed. I know that. My daughter's had 4 or 5 different diagnoses. Who knows what are we going to call it? Well, because, you know, in medicine, you have to call something the right name, because if you call it the right name, then you've got the right pill for it. Right? All right? But females make 3 to 4 times as many attempts as males. Okay? So we're not quite as good at it as the men are. When the men want to kill themselves, they just go ahead and do it. All right? And in the medical community, half of the suicides are committed by women. So, with the increase of women in dentistry, we have to take a look at how we have babies and how we nurse these babies. We know mercury passes through the placenta during gestation and into the breast milk. It's not surprising that many children of dentists have neurological and mental illnesses. Just as a little aside, at the last IABDM meeting, we had a forum at the end of day 2, and somebody asked a medical doctor, not a dentist, somebody asked a medical doctor, when is the right time to remove fillings on a pregnant woman? And he hemmed and hawed and said, I don't really know, but probably not a good idea to remove them at all. And the choir in the middle of the room all said, oh, yeah, you're right. Yeah, don't remove the fillings. Don't remove the fillings. I could not sit there. I had to get up. I'm always pissing somebody off. It's just, I don't know why. And I said, you know what? If you continue to carry the child, the mercury is going to pass through the placenta. You're going to have a kid with a problem. It's going to be maybe the kid will be born with cross eyes, and they're going to blame you for it because you took out their mercury fillings. But if you don't take out their mercury fillings, the kid is going to wind up with neurological, psychological problems all the way into adulthood. Now you've got a much bigger problem. So my attitude is, yeah, take the fillings out yesterday, but take them out safely. And the choir were the same guys who 20 years ago said, Blanche, you really don't need a rubber dam. Come on. This thing cleanup, this is sufficient. I said, really? I don't think so. So this is the same choir. So even amongst our own family does not accept the fact that mercury is so damn toxic. And it pisses me off. Really does. You know, come on. We have to understand how toxic it is and how cautious we have to be with our patients and ourselves. Okay? Yeah, we can speculate all we want, but a lot of us, the people who have the children with the neurological, psychological problems, we know how toxic it is. Okay, so this was our first study. And I just know there's going to be many more that are going to come after this. 112 dental professionals responded to our study, men and women. Of the 112 participants, 64 were women, 48 were men. 4 of the women were hygienists, 1 dental assistant, and 1 was both a hygienist and a dental assistant. The rest were women dentists. Okay, so we asked them, did they have trouble conceiving? Did they have miscarriages? How about children with physical or mental illness? Well, we got two out of that bunch of 112 doctors who answered the survey. We had 230 surviving children. 12 of the respondents had no children. Well, that made my work very easy because now I was looking at an even 100. And then I realized, oh, wait a minute, I didn't respond to the survey myself. And I have some friends who I know did not respond to the survey. And they all have children with psychological problems. So you got to look at all the numbers that I show you and know that it's actually higher than that. Okay, 7 of the respondents of the 12 that had no children, 7 said they had trouble conceiving. I think the other 5 didn't know that you had to have time for sex in order to have children, so they were clueless about why they didn't have children. Huh? 5 did. Those were the 5. They gave no indication how. You have to do that? Yeah. There were 44 miscarriages reported. When I went through as a dental assistant and dental school, John and I did not practice safe sex. I didn't get pregnant for 9 years. 9 years. And when the doctor asked, how's your cycle? Oh, sometimes I go to 55 days, sometimes 65 days, sometimes 70 days, but I haven't gotten pregnant. Guess what? I was getting pregnant. Those were all miscarriages. Because then when I finally did conceive in dental school, because I was away from the dental office long enough to conceive, then my cycle became more regular. 6 of those 230 children had issues or reactions due to immunizations. Okay, Dr. Blatter in '87 said that dental workers have a higher rate of pregnancy problems. Spontaneous abortions, I would fit into that category. Stillbirths, congenital defects. Okay, she said 24% in the dental profession compared to 11% in the outside world. Okay, and then 6 of the malformations were spina bifida. Of the physical and mental illnesses reported, 7 families suffered from anger issues. That's why I originally said we had 1 child who's been diagnosed with a mental problem. But then I'm looking at the other 2 boys, and they definitely have anger issues. Wow. Depression, growth delays, delayed speech were the next most common of the 6 families suffering with that, followed by hyperactivity, memory issues, delayed reading, delayed learning, concentration problems, 5 families suffering from each. Then we had families. These are our families. This is our immediate family here. Sensory problems, epilepsy, seizures. 3 families had children with ADD, anxiety, tics, tremors, and trembling. It was not easy sitting and reading these surveys because they poured their guts out. It was not easy. Two of the families had children that actually suffered from heart, lung, bipolar issues, puberty, delayed eruption of teeth, and other teeth issues. One family gave birth to a blind child. OCD, Crohn's disease, Asperger's, headaches, sleep issues, hearing problems, dyslexia, suicide also reported in 1 or more of the children. And then there were 21 other medical issues reported, things that I had not considered. Okay? So, here's the key. 50% of the participants, yeah, I said 50%, with children reported no reported mental or physical defects. Guess what that means? 50% did. Our number is 50%. Wow. We need to seriously look at this. And then and by the way, it's 50%, and we're the ones who wear gas masks now. So, what about all the dentists who don't protect themselves, don't wear gas masks? Okay? That is a much higher percentage than the national average. No comparison. So if 50% of us have children with neurological problems, then, the outside world, when they look at somebody with a neurological, psychological problem, how could they not say it has to do with the dentistry in their mouth? Right? How can they not say that? Okay, so here are our numbers. 7, anger issues. 6, depression. 5, suffer from hyperactivity, memory issues, delayed reading, concentration issues. 4% suffer from sensory issues, epileptic seizures. 3% ADD, anxiety, tics, tremors, or trembling. 2% from heart and lung issues, bipolar issues, problems with puberty, delayed eruption of teeth. 1% autism, and then the 21% other medical issues. So you can see it comes to 50%. It's 49.9. Wow. I don't want to ruin your breakfast, but this is the truth. 50%. So compared to the general population, mental illness and children with neurological problems is definitely on the increase. You know, we've all know about the statistics with children with autism, how, you know, at one time it was 1 in 700, then it went down to 1 in 600, then, you know, 1 in 150. Now it's 1 in 75. Okay? A lot of these illnesses, they say, oh, well, you know what, it wasn't labeled 50 years ago. Like that, what? Are you trying to tell me because we have a new name now for it that we don't see the increase? That we're just naming it better? I don't think so. It has nothing to do with what we call it. No. Okay, human health services. What they did was they surveyed parents with children from 2 to 17 and then asked them if they had any problems, developmental, emotional, behavioral, okay? And then for each condition, they asked the patients whether the doctor had told them that their kid had a condition, okay? The numbers were much lower than our family, okay? You take a look at hyperactive attention deficit disorder. Okay, I had my first mercury filling when I was 4 years old. I spent the ages of 4 to probably 10 jumping from sofa to sofa to sofa to sofa to sofa to sofa. So they didn't call it attention deficit disorder or hyperactivity because they didn't have those names back then. Was I hyperactive? I wore the rug out. I think so. Yeah, they probably would have put me in an institution if they gave me the name today, right? Okay, so 6.4% of those children have ADHD. Anxiety problems. How many of these kids are obsessive compulsive, post-traumatic disorder? You know, it's funny, if a kid is obsessive compulsive, he's called type A when he gets older. It's much better. Right? People are like, oh, Blanche, you're just type A. You just never sit still. No, you should have seen me when I was 4. You think I do a lot now. And so we had 2.9% of the children reported that their kids have these, you know, phobias, disorders, all kinds of things. Depression. Okay, yeah, it's normal for a kid to be sad once in a while. But debilitating depression where they don't want to come out of their room and they're sleeping all the time, that's another story. Okay? They have frequent headaches, stomach aches. We have a new dental assistant in our office. Her son, it's like every 3rd or 4th day. He's suffering from severe stomach problems. This poor kid is, Judy, how old is, he's 12. He's probably had 13 or 14 colonoscopies. You know, they keep trying to find something physically wrong with him, and yet he's always in pain. Interesting. So it's only 2%, though, of the population, the general population, only 2%. Okay? Oppositional defiant disorder. We have finally come up with a medical term for he's such a friggin' brat. We've come up with a name now for it. So you know there's going to be a pill for the brat pill, right? Okay? And so these are the kids who, you know, deliberately want to piss you off. They want to upset you. They never follow the rules. I think I kind of fall into that category too. You know? Yeah, I had to become a frequent flyer just so I don't have to wait in line with everybody else. I want to be on this side, you know. Okay, so 3.3% of the general population of these people surveyed said they had that problem. And then autism. And there's all kinds of autism. There's autism where they don't speak. There's autism where they do speak. That's Asperger's, but then they're banging their head against the wall and yelling and screaming at everybody. Okay? And developmental delay. This means delay in motor skills, language skills, thinking skills. 3.2% of the children reported that they had developmental delays. And then Tourette's syndrome is there's comedians that make fun of it, but it's a horrible thing to have somebody suddenly yell out a 4-letter word and start jerking their head and yelling and screaming, and then suddenly their voice changes and now they're back to normal again, right? And they said only 0.1%, and yet our numbers were higher than that. So they had a total of 11% of the children between the ages of 2 and 17 had at least one of these 7 conditions. Okay, so if you look down, I'm going to go a little faster. You look down here. Those who had 3 or more was only 1.9%. Okay? That piece of pie is a lot smaller than our pie, right? Remember our pie is 50%. And look at their pie. Of course, yeah, mostly attention deficit disorder and ADHD is the biggest one, okay? But the diagnosis of mental illness in children is increasing at an alarming rate. Including attention deficit disorder and obsessive disorder, autism, okay? And you guys can read, when you get these slides, you can read them as well as I can. 2012, depression. 16 million adults had at least one major depressive episode in the past year. That's 6.9% of all the U.S. adults. That's astronomical. Can you imagine that? Almost 7% of the population has had a period of depression. Okay? If they saw Eliezer's lecture, they'd realize, oh, this is just a speck in time, right? Then we go on. Bipolar, 2.6% of the U.S. population diagnosed. Schizophrenia, 1.1%. That's a total of 10.6% of the population suffer from depression, mental problems, depression, bipolar, schizophrenic. Our dental population is 18% of specifically just those. If you add those plus something else, again, we're much higher. Okay, so, last night, those of you who went to the Terry Fader show, we had a ball. It was so great. But as becoming more and more typical here in Las Vegas, they will sing a song and honor the veterans. And I think that's wonderful. Terry Fader took it one step further and honored all of those who put themselves in harm's way and are our heroes. And of course, they put pictures of policemen and firemen and military guys. And I sat there thinking, wait a minute, how come there's no pictures of dentists? How come there's no pictures of dentists with gas masks on, taking out somebody's mercury filling so they can live a better life? We put ourselves in harm's way every single day. And I wanted to quit one day. And I said, Becky, there's got to be a better way for us to make a living. And no sooner I said those words, an angel came over to me on the right and said, yeah, but you guys are the stuff saints are made out of. I went, really? And Becky said, somebody's talking to you again? Becky's been with me a long time. I said, yeah. So we are the heroes. We should all be patting ourselves on the back. Absolutely. And I applaud all of you for doing what you do, because there are better ways to make a living. That's it. I told you I'd be done on time, Dawn.
Thank you, Blanche. Any questions for Blanche? And I'm assuming we're going to publish that.
Oh, yeah, it's going to be published.
Yeah.
And I'm going to apply for a grant because the next step is to do all of the dentists. The whole 170,000 of us. And somebody needs to take a serious look at that because as a profession, they tell us we have to buy our own insurance. Really? If we're the heroes and we're taking out everybody else's fillings and we're becoming mentally ill and committing suicide and all of that, no. Where's our disability? Where's our disability package? Okay? So I can already see the next step is to do a national survey. After that, it's to go to Congress and say, take a look at this. Take a look at these heroes. And what are you going to do for us? Because you're doing for everybody else. Right? Everybody else is getting all kinds of pensions and all kinds of, packages. We're not. We have to create our own. And if you want to purchase disability insurance, you're spending a lot of money doing it. Somebody needs to seriously take a look at this. So that's the next goal. Any other questions? Yes. Ah.
And I guess basically the reaction when I first started doing it was obviously pain. But I think the survey should be redone.
It should not be done?
It should be redone.
Oh, okay.
Okay, because just speaking in your lecture today, I started thinking about each one of my 4 kids. I was only focused on one.
Right.
In the survey.
Right.
So just with what I see in the other 3 children, the results are much more greater.
Right.
So even some guidance with the questions, just little things, and rather than asking us to list the things,
right,
kind of maybe an overview ahead of the survey, and then saying, these are type of criteria.
Right.
That would be my only suggestion.
Right. Because, we lost a little girl after Christiana. So we have Christiana was born first with all kinds of mental problems. Then we lost the second child. She was born and then died that day. And then our 2 sons came after that, and they both have serious anger issues. Yeah. So it's just like nobody walks out of this profession without at least one bullet in your ass. Okay. That's the way it is. Yes. Yes. No, this is a profession problem. You're right. Well, you know what? Dr. Huggins has always shown that men carry the mercury in the sperm, so they contribute just as much. We contribute more because we breastfeed, and we're carrying the baby. You're right. 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 Probably. That's right. Yeah, I see what you're saying. Yes, if you look at just the women, it's not 50%. It's probably much, much higher. Yeah. So now we got 50% of the women going into dentistry. Somebody's got to tell them. Consider selling insurance. Really, Louis Felix.
I agree that the survey should be redone, and when you redo it, I would suggest that you survey the women dentists or the wives of the male dentists,
right,
on their moods,
right,
and their temperaments,
right,
and their hostility,
right. What?
Because
what makes you think we have a problem?
we want to get to the base of the iceberg.
That's right. That's right.
Before they walk off back in the back, can you hear me? Before they walk off back in the back, I want you to make sure and tell Blanche thank you because Biocomp sponsored the breakfast.
Yes, Biocomp sponsored the breakfast. And thank you. IABDM paid for the survey. So, thank you, Dawn. Really.
Blanche?
Yes,
I want
David.
to add something here.
You're going to show me the scrambled eggs? Where are you going?
I want to get back to my seat. I don't recall my source for this. Honestly, I think it may be Sherry Rogers, but it's within the context of what we're talking about. And what I understand, and this may come, I want you to think about it if you've never heard about it before, but for a woman, pregnancy and birth is the greatest detoxification that exists.
Oh, absolutely.
So,
yeah, that's true.
So no matter how you cut it, you are removing from yourself a huge burden. Whatever you've had is resident in that child.
Right, but you're giving it to the child. You're almost better off not having the children. And if you want to be a dentist, go ahead.
Different, that's a whole different philosophical thing.
Yeah, it's we could talk about this over a glass of wine.
Or not, or both. Yeah, for sure.
To enter into the profession or not. Yes.
Our next speaker is going to be at 8:30.
Oh, okay.
And so I need to make sure that they have room to do some housekeeping. If you guys need to take a short break, we need to get set up for the next speaker.
We have one last question in the front.
Okay, I'm sorry.
Would also fill it out. I think that would be helpful too, because like some of my women dental assistants have been practicing 34, 35 years. Every one of their children has serious, I try to help them out. They always need time off work, serious problems, whereas I've been a little luckier. I think there's something having to do with repeated exposure. Obviously, a lot of us women dentists, like you showed the stats, we have there's not that majority that have been practicing 30, 40 years, whereas my assistants have. So if you send it to the offices, it'd be nice to include the women dental assistants that have been chosen.
You're absolutely right. All right, thank you.
Big hand for Blanche again.
Thank you.
Good job,
very
kiddo.
much.
Woo! Dawn, you have some things to say? I doubt it, hey? No, I guess not, no. Oh, okay. You do have things to say. That's weird.
You guys, please stop by. Roberta put a great deal of effort into making little earrings and necklaces with the no mercury, no fluoride pins. I would love to see you make some kind of a donation. That is all going to Andy's wife. And so stop by and get a pair. That's it. Go to the vendors and go to the bathroom, and let's get ready for our next speaker.